More patients could needlessly die this winter because of mistakes made by the ambulance service. That is the warning from one of the UK's top doctors after an ITV News investigation found a shocking 72% rise in the number of serious incidents involving ambulance crews in the UK last year. They're mistakes that are so significant they warrant investigation and often result in a patient dying or being seriously harmed. Last winter, they included a baby who was discharged and then suffered a cardiac arrest, a child released with an open fracture, and several examples of patients being dropped. In the most extreme cases, patients died unexpectedly. This family believed their father's death should be recognised as a serious incident.
They got there quite quick because they thought it was a stroke, but they weren't here that long. Not really, not to assess him properly. It was just disregarded.
They made that decision not to take him. They've got no idea of the pain and the torture that we've had to go through.
The ambulance service denies it was a serious incident, although it has admitted being at fault. At one ambulance trust alone, nearly 3/4 of the recorded serious incidents involved deaths that were unexpected or could have been avoided. So why are ambulance services making so many mistakes? Demand has never been so high. Ambulance staff worked flat out, responding to a record number of call-outs last year. More than 10 million were made to the service in England alone. In fact, there's been an average 5.2% rise in calls every year since 2011, and similar increases in Scotland and in Wales. Several factors contribute to this rising demand, including more elderly patients and an increase in the number of alcohol and mental health-related call-outs. So ambulance staff are under immense pressure, particularly during the winter time. The service is underfunded. Investment in the ambulance trust hasn't kept up with the rising demand. Between 2011 and 2016, the budget for ambulance trust increased by 16%. Over the same time period, the number of call-outs rose by 30%. The service is also understaffed. Ambulance trusts are struggling to recruit the staff they need. 1 in 10 paramedic roles is still left unfilled, and in recent years the number of ambulance workers quitting has doubled, with many sick of low pay and the stressful nature of the job. And that is why one of the most senior doctors in the UK is worried.
We've got an ambulance service stretched to its utmost capacity. It's almost going to be inevitable. There will be more serious incidents. The pressures are still there. The capacity in the hospitals hasn't really changed.
Well, what's the NHS response? The ambulance service told us that last winter was particularly challenging, that they've learned lessons from the mistakes made, and they say the number of serious incidents is relatively small compared to the large volume of patients they look after. Ambulance workers save lives every day, but the brutal reality of the profession is that if mistakes continue to be made, lives will continue to be lost.